Hello guys, so today's topic is enzyme inducers and inhibitors. It is a very important topic from pharmacology and a lot of questions are asked in a clinical manner or a non-clinical manner. We will learn how these questions are solved. Okay, so first of all there is cytochrome P450. Now this cytochrome P450 metabolizes drugs and degrades them. Okay, but this cytochrome P450 may be influenced by an inducer or an inhibitor. If inducers act on the cytochrome P450, they will activate the cytochrome P450 and hence drug is more metabolized. But if in case inhibitors are given, inhibitors will downgrade or decrease the action of cytochrome P450 and the drug will be less metabolized. Okay, so this is the basis of enzyme inducers and enzyme inhibitors. So let's see what is important in it. First of all, enzyme inducers. Enzyme inducers stimulate the cytochrome P450 and hence drugs are metabolized by the cytochrome and are metabolized faster and hence don't work. Okay, so this is the inducer. These are work of inducers. So how can we remember which of the following drugs are inducers? We can remember by the mnemonic: chronic alcoholic, steal phene, and never refuse greasy carbs. Okay, so first, chronic alcoholism. Chronic alcoholism is an enzyme inducer of cytochrome P450. Then steel, St. John's wort. Then phene. Phene stands for phenobarbital. Then another phene stands for phenytoin. Fifth, nevirapine. Sixth, refuse, rifampicin. And lastly, seventh and eighth, greasy, G for glycofulvin, and carbs means carbamazepine. So these are a list of enzyme inducers. You have to remember it. Now coming to enzyme inhibitors. So as we already know, the enzyme inducers, it is just opposite of enzyme inhibitors. Okay, so in inhibitors the cytochrome P450 will be inhibited and that's why the drug will not be metabolized by cytochrome P450 and can act more. Okay, so what is the mnemonic of enzyme inhibitors? It is sickfaces.com. Okay, this particular mnemonic is given in first aid and the above mnemonic also over here is from the first aid book only. S for sodium valproate, I for isoniazid, that's for sodium valproate, I for isoniazid, C for cimetidine, K for ketoconazole, F for fluconazole, A for acute alcohol, C for chloramphenicol, E for erythromycin, S for sulfonamides, C for ciprofloxacin, O for omeprazole, and M for metronidazole. So these are the list of enzyme inhibitors. See the first question. Which of the following should not be prescribed to theophylline? Which of the following should not be prescribed with theophylline? So let's see how to solve this. We all know that theophylline is a drug which can be used in asthma. Okay. Now theophylline has a narrow therapeutic index. We all know that digoxin, theophylline and lithium, etc. have narrow therapeutic index. And since they have narrow therapeutic index, our main goal should be that theophylline in the serum should not be high. Okay, theophylline in serum should not be high, which means that we should not give enzyme inhibitors, because if we give enzyme inhibitors, then what will happen, that cytochrome P450 will not metabolize theophylline and throw out of the body, and that's why the amount of theophylline will go up. So we should not give enzyme inhibitors. And which of the following is an enzyme inhibitor? Erythromycin. So this is your answer. Okay, now coming to question 2. A patient is on oral contraceptive pill. A patient is on oral contraceptive pill for family planning. Which of the following drug should not be given? Which of the following drug should be avoided to prevent contraceptive failure? See, now OCP is metabolized by cytochrome P450. OCP is metabolized by cytochrome P450. There is cytochrome P450 and OCP is degraded from it. Okay, now when will there be contraceptive failure. There will be contraceptive failure when OCP is not there and the OCP is degraded faster, means cytochrome P450 is acting higher, which means when we give an inducer. Which of the following is an inducer? The only inducer in over here is, from the list we can see, the only inducer over here is rifampicin. See, rifampicin. Okay, the rest all are enzyme inhibitors. So rifampicin is your answer.